Around Arkansas, new numbers reveal a trend downward when it comes to kids committed to youth services facilities in the state. In the fourth quarter of this year, 81 kids were committed to a youth facility in Arkansas. Last year, during that time, the total was 101, and in the fourth quarter of the year before, it was 121. These were some of the figures the Director of Youth Services presented to the Senate Committee on Youth today. He says it can be attributed to new individualized treatment plans for the children compared to in the past, which was what he described as a cookie-cutter approach.
I really think they're doing a better job of using that tool to decide whether or not a child really needs to be committed to our custody and be behind a fence, typically in a residential setting, or whether they can receive those services in the community in a less restrictive environment.
When kids are brought into a youth services facility, they're able to meet with clinicians and education specialists for a couple of weeks. Those staff members then also do a follow-up 1 to 3 months later. Another new element to youth services is the addition of a peer recovery specialist who helps kids battling drug addiction. This specialist is a former drug addict herself who uses her own experience to relate to the children, of course, on a similar level there.